General anesthesia, also known as being put to sleep, will put you into a controlled state of unconsciousness. This is to ensure you are comfortable and pain-free throughout your procedure. To begin with, the healthcare team will attach some monitors to check your blood pressure, heart rate, and blood oxygen levels. Other monitors may also be required depending on your individual circumstances. These monitors will provide important information about your health during and after the procedure too. The anesthesiologist will insert an IV into a vein. It's usually in the back of your hand, but could be elsewhere depending upon your individual circumstances. An IV is a small plastic tube that sits in the vein and can be used to give medication and fluids. Inserting the IV may hurt a little, as a needle is required to get it through the skin and into the vein. It's usually over in just a few seconds. Once ready, the anesthesiologist will give you the anesthesia drugs through the IV into your veins. The medications will flow directly into your bloodstream and throughout your body. You'll also be given oxygen through a mask over your nose and mouth. Occasionally, the anesthesia is given as a gas, which you breathe in through the face mask. You'll slowly drift off to sleep and become unaware of your surroundings. Once you've gone to sleep, the anesthesiologist will pass a breathing tube through your throat into your windpipe. The tube is attached to a machine which helps you breathe while delivering the oxygen and gases to your lungs. Deep in your lung tissues, the gases are absorbed into your bloodstream and carried by blood cells throughout your body and brain. The anesthesia prevents your brain from receiving messages from nerves in your body. As a result, you'll remain asleep and pain-free during your procedure, and you'll have no memory of it when you wake up. Once safe, the procedure will start. During the procedure, the anesthesiologist will monitor you and give you the correct amount of medicine to keep you asleep and pain-free. You may be given fluids and other drugs such as painkillers, anti-sickness medicines, or antibiotics through the IV so you wake up feeling as comfortable as possible. After the procedure, you'll be given medications to reverse the anesthetic and you'll wake up. The breathing tube will be removed as soon as you can safely breathe on your own. You'll be taken to the recovery room where you'll be closely monitored. You may feel lightheaded and slightly disoriented at first, but this feeling should pass quickly. The nurses will make sure you're comfortable, not feeling too sick or drowsy before you go back to the ward. The contents of this video are a general depiction of this type of anesthesia. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Watch this again to ensure you've understood everything.